Hello, everyone. It's Tuesday, June the 29th. I am, I am delighted that over the weekend, and if this is just not delayed news coming in and everything, but we've only had 3 deaths. That's probably the lowest that I've announced in a long time. And I hate it like crazy for these individuals and all their loved ones, that's for sure, but we continue to trend in a really good way, and that's good stuff. Our 2,877th death is an 80-year-old male from Kanawha County. Our 2,878th death is a 70-year-old male from Jefferson County. And our 2,879th death is an 85-year-old male from Nicholas County. Again, 2,879 great West Virginians we've lost, and we just cannot let them become numbers. They've given us so much. They've given us incredible wisdom, and we cannot forget them. And if you happen to know these folks and know their families, please contact them. Please reach out and tell them you love them and let them know that they're not alone. We only had 25 new positive cases since last Tuesday. 25, and maybe that's since last Thursday. Is that since last Thursday? I'm sorry, since yesterday. We had 25 new positive cases since yesterday. Our daily positivity rate is at 1.29. Our cumulative positive is at 5.02. Our active number of cases in West Virginia is 1,378. We're under 1,500 cases for the first time since last May. You know, it is unbelievable how this continues to trend the way we want it to trend. We have recovered cases of about 160,000. We only have 84 people in the hospitals right now, 24 in the ICU units. Continue to pray for all of them, please. And get this, we have no red counties. We have no orange counties. We have no gold counties. We have one gold county, is that correct? And one yellow county, or are they both? We have 2 yellow counties. You know, it's really better. In West Virginia, you're doing so much better. We have, for the people that are 65 and older, I continue to tell them, please go get a test if you feel the least bit bad. We can stop this with the antibodies. Our vaccine eligibility is for all the folks above 12 years of age. I encourage you over and over to get your second shot. I might as well just tell you this right now, but Pfizer came out and announced that their vaccine is highly effective against the Delta variant, and that Delta variant is one that is scaring us to death. The Moderna, people just announced that their vaccine is also very effective against the variants, the COVID variants, including the Delta variant. Now, again, I just go back to just this. Pfizer's telling you that their vaccine is very effective. We know it's 97% effective or whatever against COVID, but they're saying it's very effective against this Delta variant, which is a real problem. Moderna is telling us the same thing. Their vaccine, very effective against Delta, also effective against the other variants. We all know, this is more and more good news for the people that are vaccinated. Now, if you're not vaccinated, what are you going to do? I mean, really and truly, what are you going to do? I mean, do you realize that everything is opening up? The NBA, the Coliseums are packed. The golf tournament is the places where, you know, the Travelers event that just got through this last weekend, packed. All those people that are walking around there, the Delta variant, the other variants, COVID, is all around. If you're not vaccinated, what's the chances? What's the chances of you ending up with this? Well, you know, in all honesty, they're too big a chance for me. That's why I'm vaccinated. You know, I think they're too big a chance for you too. You really got to think about that. What are you going to do? Now people are not wearing masks. There's no protection. If you go into a McDonald's or you go to a golf tournament or you go to a basketball game, there's no protection. People are walking all around everywhere. This virus is everywhere. And you're walking around unprotected. Not smart, not smart. You need to really think about that. I encourage all of our people, the parents and grandparents, to help us with the younger people. You know, we're going to have our second lottery drawing tomorrow on Wednesday, June the 30th. We're going to give away another $1 million. We're going to give away 2 brand new trucks. We're going to give away 25 weekend getaways at our parks. We're going to give away 5 lifetime hunting licenses, 5 lifetime fishing licenses, 5 hunting rifles, 5 hunting shotguns, and 2 full scholarships to our kids. You know, absolutely, we want you signed up. We have 313,000 folks. Your odds of winning are phenomenal, phenomenal compared to just a general lottery. You know, so look to see us, and you know, and I hope good things for all the folks that are out there, but especially more than anything, all I'm trying to do is continue to encourage you in every way to get vaccinated. You are running such a risk that it is unbelievable. Why run the risk? I mean, I just don't get it. Why run the risk? The vaccine distribution update is we're at 86.8%, 76.9% of those that are 65 and above are fully vaccinated. Get this number. For those that are 65 and above, we have 86.6% of those folks in West Virginia that have their first dose. We have 78.6% of the 50 and above have their first dose. We are now, in the entire population of West Virginia, 12 and above, that are eligible to take this vaccine, we're at 63.5% that have had their first shot. That's good stuff, really good. We're continuing to trend upward at approximately 1% every 7 days, and it's not as fast as we need it to be, but it's still pretty dadgum good. So as we continue to trend up, we're going to absolutely squeeze and absolutely kill this terrible virus and this terrible killer that is eating us alive. It has taken a grand total of 2,879 great West Virginians. So every day we get better at stopping it. And the only way we're going to continue to get better is you get vaccinated. So just think about it. Please help us. From the standpoint of our businesses and church outreach, the same thing over and over. I say we'll come to any business, we'll come to any church, we'll do your congregations, we'll do your employees. Just call us and we'll come and we'll vaccinate. You know, all the vaccine info line stuff is up there. You know, your testing map that's free. We thank Fruth and Walgreens over and over. And I would say, please take advantage of our testing and everything as we continue to go forward. We have 4 outbreaks in our long-term care facilities. We have 0 outbreaks in our church community. That's wonderful. We have 1 inmate in the state of West Virginia that has COVID and 4 staff cases. And I encourage you over and over and over to think hard about giving blood. Other than that, that's all I've got right now. And so thank you so much, and we'll take your questions in just a few minutes.
All right, thank you, Governor. Let's now go to Secretary Bill Crouch with the DHHR.
Hello, everyone. I want to remind folks that this week residents of 4 counties in West Virginia may apply for DSNAP benefits. That is disaster SNAP benefits in 4 counties through this Friday, July 2nd. This includes West Virginia residents who did not receive SNAP and who lived or worked in the counties of Cabell, Kanawha, Mingo, and Wayne, and were impacted by the flood that occurred February 27th through March 4th. These individuals may be, or there are individuals who may be eligible for disaster supplemental nutrition assistance program benefits. Because of this, residents who are not normally eligible for SNAP may qualify for DSNAP as a result of the major disaster declaration. We estimate that more than 1,500 West Virginia households may be eligible for this federal assistance. Eligibility will be based upon households' net income. Residents who are not normally eligible for SNAP may qualify for DSNAP as a result of the major disaster declaration. Please check DHHR's website for locations where you can apply for this service. Thank you.
All right, thank you, Secretary. Dr. An Amjad, our State Health Officer, is also joining us today and is available for questions. Dr. Clay Marsh and retired Major General Jim Hoyer had prior engagements today, and they will rejoin us next time. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, everyone, and good morning, Governor. And let me just first say a shout out to Dr. Sherry Young, who announced yesterday she's stepping down. What a wonderful job she has done, not only for the Kanawha-Charleston Health Department, but as a leader in the entire state against this disease. And so thank you, Dr. Sherry Young, for all you've done, and best wishes for you and your family as you march into the future of your medical profession. Now, my question is this, and perhaps Dr. Amjad can answer it. I noticed yesterday on the dashboard there were 4 Delta variant cases in West Virginia. Today it is 12. I don't want to sound like I'm an alarmist, but that's a tripling in just one day. How serious? And I noticed the biggest, I apologize, the biggest number of cases are in Monongalia and Berkeley counties. What are the big concerns now with the Delta variant apparently growing kind of rapidly in West Virginia, and what's your best advice?
Dr. Amjad, please.
Yes, Governor. So Mark, yes, and there is a tripling, and our concern is just like in the rest of the country where you're seeing the spread of the Delta variant. We do want people to get vaccinated, and that is our main concern. So we're unclear right now with the cases, but if it's necessary in unvaccinated individuals right now, because we're still gathering some information. But in the rest of the country, the cases with the Delta variant are, of course, in people who are unvaccinated. So that's one reason why we keep pushing for people to get vaccinated, especially in West Virginia. But right now, our biggest concern is to making sure everyone gets vaccinated fully. But the cases that we're seeing right now, as you mentioned, went from 4 to 12. So just like on the other cases, the UK variant started getting higher and higher in West Virginia. We do expect to see some of those cases as well. So we need to remind everyone to get fully vaccinated in West Virginia. Otherwise, we can see a rise as well. Thank you.
All right, thanks, Mark. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Switching gears for a moment, Governor. You got 21 out of 24 bills last week in Thursday's special session. A little bit of trouble on the House side, but they ended up passing those bills late into the evening, Thursday evening. Like I said, 21 out of 24 ain't bad. What are your thoughts on getting the majority of your items through, and are there any concerns about not getting those other 3 bills through? Thank you.
Oh, Stephen, we wanted to go 24 out of 24, that's for sure. But overall, really good session. I appreciate the legislatures and appreciate their oversight. And in all honesty, I'm not concerned at all about getting the other bills. I think the 3 that we didn't get through, total, I think one of them was a couple $1 million, and the others were like $850,000 and $750,000. So they were really, for all practical purposes, really insignificant. But at the same time, important in their own way. From the standpoint of we pushed rainy day, You know, the rainy day fund is $1 billion now in West Virginia. I mean, a health like you can't imagine for our state, and absolutely just what it ought to be, a rainy day fund for times when things could turn bad. And I hope that we're never going to see that. And I'm going to try everything with all in me to see that it doesn't happen on my watch. And so a lot of different things that we got done with surplus dollars that we've grown. And, you know, Stephen, I've said it over and over, you know, and I don't mean this in any way tooting my horn, because a lot of people have really worked really hard all around me to make good things happen. But it's pretty daggum hard to argue. You know, you walked in and, you know, state dead bankrupt, and now we're producing surplus after surplus, and good things are happening within our legislature. And now we've got $1 billion in the rainy day fund. So lots and lots of good stuff. And I was tickled to death with the session.
All right, thanks, Steve. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to follow up on Stephen's question. You know, Governor, we've had 2 special sessions right in a row. Do you anticipate the need for any more in the immediate future, calling the lawmakers back to appropriate any more funds? Thank you, sir.
I do, Charles, from the standpoint of now we'll move on to handling, you know, the stimulus dollars, you know, I think it's America Rescue Plan or whatever. And so, you know, and we'll dial into things like broadband and things like that are, you know, high on the priority list with me, and it's the same with the legislatures, and we're going to work with them, and we're going to get through it, and we're going to try to, you know, try to set buckets and everything to where we can direct dollars and do them prudently and make more goodness happen in West Virginia, bring more opportunity, bring more jobs, you know, bring more prosperity and goodness to West Virginia.
Thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Good morning, fellow journalists. Governor, I wanted to ask you about the help wanted signs that we're seeing around West Virginia. A lot of businesses out there are operating again, but they can't operate at full capacity. I know that you've made a move on the unemployment issue. Is there anything else that can be done, or are you considering anything else to help these small businesses that can't operate for long when they're not working full-time themselves? Thank you.
Well, Paul, it's a problem, and it's a problem all across this nation. You know, we have awakened like a sleeping giant, you know, from a terrible, terrible pandemic. And we have tried to jumpstart our engines and everything, and lo and behold, we've got a situation that's a chronic need all across this nation. We're all competing with one another, you know. And Paul, I go back to this, you know. We were poised in a situation, and I don't want to beat a dead horse, but we were poised in a situation to try to move forward with a significant reduction in our personal income tax and finally the elimination of our personal income tax. And with all of that and everything, what would have happened? You would have driven lots and lots and lots of people to West Virginia, and maybe we wouldn't have had all those signs up, that where people are looking for workers. But nevertheless, you know, we are stymied in that in lots of different ways. You know, I think the communication of it really just got way out of hand, and it really just got, really just miscommunicated in lots of different ways. And the message, as hard as I tried, the message really didn't get to the people in the proper ways. The other thing is, you know, because of legislation that was drafted into the bill and everything, and we all know where that legislation came from. You know, it could very well make it impossible, you know, for us to be able to proceed forward no matter what we'd like to do, because, you know, of one of our very friendly senators decided to draft some language that basically forbid any of the states from reducing their taxes and everything as you move forward, and still take your stimulus dollars, even though they may not be applied whatsoever, to a tax, or to a tax reduction. So there's all kinds of obstacles there, but what do? We just go on, and we just keep trying to bring more and more goodness, and trying to incentivize people to come here, and with that, you can always think back and just say this is, for people that are on the outside looking in, they're really seeing West Virginia in a different light today than they've ever seen it before. From the standpoint of them coming, there are folks that are coming. We had an opportunity to have them come by lots and lots. We passed on that opportunity. So what do? We just keep trying in every way we possibly can to tell the world just how great this place is to live, and how friendly the business climate is now. And from the standpoint, we've got a conservative Supreme Court, we've got tort reform, we've got all the things in place for lots and lots of people to look at West Virginia in a different light and come. We've got skilled employees, we've just got the 4 greatest seasons, we've got the proximity of location, and we've got natural resources beyond belief, and a diversified economy that is really cooking. If you'll just step back and think what we're doing, and we are deriving the lowest percentage of our revenue from severance tax than we have done in the last probably 25 years. It's amazing. It is totally amazing. And the great part about it, on top of all this and everything, our coal jobs are going pretty decent. Our gas jobs are going pretty decent. Not to beat a dead horse, but we should have moved when we could have tiered the severance tax, on coal and gas, because it would have helped us in this state right today. So nevertheless, we're going to keep going forward. We're very thankful for all those folks upstairs and all the great work they're doing, and at the same time, we're just going to keep going north.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. My question is, what friendly senator were you talking about? No, I'm kidding. That's not really my question. My actual question is, a few bills that were about to become law in West Virginia are facing legal challenges. The U.S. Department of Justice has said West Virginia's bill on transgender athletes is unlikely to stand legal scrutiny in the long run. Meanwhile, a circuit court judge granted a temporary injunction on a bill people call the Paycheck Protection Act. And now, as of yesterday, a federal judge has granted a temporary injunction on new restrictions for harm reduction programs. My question is that trend. Should those bills have received more scrutiny before becoming West Virginia law? Thank you.
Well, Brad, I'd say that's argumentative if they should have received more or not, but they'll make their way through the courts, and the outcome, will be whatever the courts, decide. I think it's way premature for us to say, well, should they have had more scrutiny or whatever, but the net of the whole thing, if I could just comment on one, the transgender bill, from the standpoint of West Virginia, I don't think anybody here is discriminating against transgender people. My whole thought, and I can't speak for everybody, but I can say my whole thought was one thing. I thought it was terribly, terribly unfair to our girls, kids that were absolutely trying to compete athletically, to be able to try to have to compete, against those folks that, are transgenders, and I think really that's the whole thing from my standpoint. It had nothing to do with discrimination in any way. My gosh, I hope and pray West Virginia is always a very welcoming state and loves everyone, but from my standpoint, it was all about just athletic competition.
All right, thanks, Brad. Next to Mark Cram with WDVM.
Well, good morning, Governor. Good morning, Dr. Amjad, Secretary Crouch, and all the fine members of the media here. I'm pleased that Eastern Panhandle residents check in on this update and that they're able to hear from their governor. Many of them are excited about seeing individuals, their fellow citizens, win prizes through the because they did it for Baby Dog. Question I got today is in regards to tax returns. Some residents have received letters indicating the tax department is working on their refund. Others have heard nothing at all. They said one individual from Hampshire County, he says he even checked the website, would like to know when his refund is coming. And there's my question. So thank you very much.
Mark, how you doing? Good to see you today and everything. Mark, I'll have to get back to you on this. I don't know the status of the refunds, you know, where they are and everything. I know our tax people are working on it all the time. Maybe before we're done, you know, with the briefing today, you know, I can get back to you. But I know you know, I know our tax department's doing a terrific job. I mean, you know, I've had the opportunity to meet with them. You know, I met with them almost daily forever, and I know their heart and I know their soul and everything. And there's absolutely no need whatsoever to delay in any way the refunds going out in the state, because we're doing that good. So I'll try to get back to you before the briefing's over.
All right, thanks, Mark. Next to Veronica Obey with WDTV.
Thank you. Good morning, Governor. Good morning, everyone. Now that the NCAA panel says players can profit off their name, the Ohio governor has signed an executive order to allow it in their state. Governor, is this something you would consider doing here in West Virginia? And secondly, California added West Virginia to the list of places where state-funded travel is banned because of the transgender bill you recently signed. What are your thoughts on that, and do you think this will affect West Virginia's economy in any way?
Well, I surely to goodness don't think it's going to affect West Virginia's economy, and I hate that the state of California maybe just came out and did that and everything, and you know, and I know too, the state of California does some pretty strange stuff. I mean, you know, from time to time, and I don't think West Virginia in any way ever wants to be California. But we welcome all the California folks here, and if they came, they'd see exactly what they're really missing in California. They'd see a loving, appreciative people. They'd see absolutely kindness like, you know, you can't imagine, and I see it all the time. I mean, I was with a fellow that just moved here from North Carolina. He said, you know, the thing that absolutely is the most astounding to my wife and I, and this is listen, I don't blow smoke in anybody. All I do is to ever tell you just the truth. Now, and here's his words. He said, the thing that absolutely the people here don't probably see is just how nice and how welcoming all the people are. He said, you know, you go into a restaurant in North Carolina, they may serve you, but at the same time, they'll bite your head off. And he said, absolutely everywhere you go here, everywhere, you stop at the service station, anything, and everywhere you go, the people are unbelievably nice. And that's my wife and I absolutely see it every day. And we hope to goodness that all the people of this great state will get just that, because they are really, really special. Now, you know, from the standpoint of, you know, I just got to know, and put that back up. What? Oh, I know. Oh, gosh, I forgot about this. You know, but Craig Blair the other day, our Senate president and everything, he called me on the phone. It was about, I don't know, it was probably 6 o'clock in the evening. And he said, there's a family here from California. And I think, I know they had, I think there was 3 kids and mom and dad. And they were here from Los Angeles. And he brought them over to the mansion, and I met them and everything, and we did a bunch of things. We took them on a little tour around the mansion and stuff like that and everything. And he had them over here and everything, doing stuff, upstairs in the Capitol and everything. And they were just raving over West Virginia. So I'd forgotten about that. I'm really glad that they threw up, that point and everything, that there was a family here from California. And they were looking at the possibility of moving to West Virginia. So we welcome all Californians to this beautiful state. And I'm sure that they have a beautiful state too. They've got some leadership that's probably, out in left field, maybe way too far. And so we welcome them here. But I hope I answered your question. The other part of your question was paying athletes. Look, it used to be so wonderful that our athletes, went and they competed in sports, and then they got their education, and then they went on to other levels. And today this has gotten so commercialized that, to be perfectly honest, our schools, are profiting from their hard work and everything in many ways, and they're profiting from the benefits of all the greatness that a full scholarship or an education and all those things are giving them. I'd have to look at it a lot. I think it would take our legislature to make that decision, and for that decision to come to me. But there's pros and cons on both sides, and it's something that we'd surely have to have a lot of discussion about. And the only other thing is, is we have checked this, but would you put back up about the refunds, please? Somebody put that back up. Let me see. Okay, this just flashed up to me that 95%. I guess this is back to Mark. 95% of the refunds have been paid out. They've already gone out. The only outstanding ones have some kind of documentation issue, and we're reaching out soon, and to try to clean up any of the documentation issues, but 95% of the refunds are already out.
All right, thank you, Veronica. Next, we'll go to Junaid Dill with the AP.
Hey there. My question was just about paying athletes too, so that's all I had. Thanks.
All right, thank you. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. My question would be for Dr. Amjad. So I am wondering if you could just tell the public a little bit more about what we should know about the possible heart inflammation side effects that are being reported with Pfizer and Moderna. The FDA just updated some of their fact sheets for these vaccines. Just let us know what we should know about that.
Dr. Amjad, go please.
Sure, June. So they just put out, the FDA did put out some warning labels for the Pfizer and Moderna vaccine. So they are seeing a few cases, mainly in adolescents. This tends to be more in males for some reason, but the younger populations, when they get their second dose vaccines, the mRNA vaccines or the Pfizer and Moderna, there are a few cases, but they're basically warning anyone who has symptoms of shortness of breath or chest pains to go see your doctor right away. And it tends to be when you get the second dose of the Pfizer and Moderna vaccine. However, they are wanting patients and family members to know that if you are going to outweigh the benefits, that the COVID vaccine does outweigh the risks benefits to the risks of those side effects. So even though those warning labels are out there, that the COVID vaccine is still more beneficial because we are seeing very few cases of those, pericarditis or myocarditis, and those are treatable. Those symptoms that you are going to report, chest pain or shortness of breath, you go see your doctor. They can find the diagnosis. Those are treatable with medications, but those labels are out there. But we still encourage people to consider the vaccine over those side effects. But those are the symptoms you would look out for if you are to have any. Thanks.
All right, thanks, June. Governor, I'll turn it back to you.
Okay, well, let me jump in with 2 or 3 things real quick. First of all, special thanks to Sherry Young. Sherry's done a great job, and we've worked, hand in hand here, at the governor's office with her, and she'll be missed. I know she's going to hang around for a while until her replacement gets there, and that's really good and appreciated. But Sherry, thank you so much for all you've done. It's good work, and we thank you. From a standpoint of this Delta variant growing, and I'll never ever forget till I die. Dr. Marsh, we were at a television station, I think Mark Curtis's station. We were doing some talk show or whatever there with Mark, and at that point in time, we had just had our first and our second, positive case in West Virginia. And about that time, when we were walking out of there, we had 2, for a couple of days or a week or whatever. And then all of a sudden, they came right to us and they said, we have just doubled and we're 4. I mean, it didn't sound like anything. And Dr. Marsh turned right to me and he said, this thing is going to go right now. This thing is taking off right now. Well, the Delta variant that was reported, we were at 3 or 4, and now we're at 12. That Delta variant is something to really be concerned about if you've not been vaccinated. And if you're not vaccinated, we all know the infectiousness of that variant is much greater than COVID, and it moves that much faster and everything. You better really think about getting vaccinated. From the standpoint of, what Dr. Amjad just said, in regard to cases where kids were, having some kind of issue and everything, I think, again, for what I know, I think that kids, if they have any kind of symptoms, and I think it was with the second shot, what they need to do is go back to the doctor. I think there's medications and everything that can take care of that, but at the same time, I want to just end by just telling everybody just this. We all know that there is nothing that is totally risk-free. There's no way that we can take away all the risk on anything we ever do. If we get up in the morning, there's some level of risk. With this terrible killer, there's been some level of risk all the way. The benefits are phenomenally better and outweighing of the bad. Now, with all of this, it is just as simple as just that. We cannot take away all the risk on anything we do. But the risk of just walking around and saying, well, this isn't going to happen to me. I say it this way. I don't know if it's 35,000 or whatever it may be, but I'll never forget Dr. Mills in a safety class, a graduate safety class at Marshall University, walked in his first day. And he went right to the podium and he stood there as eloquently as he could stand there and said, dearly beloved, we're all gathered here today to pay tribute to this life. And then he said, 50,000 people at that time of year died on our highways, 50,000. And it was tragic beyond belief. We have lost hundreds and hundreds and hundreds of thousands of people to this terrible killer. He said 50,000 die on the highways. How many of them do you think died that day? And they left their house that morning And they said, you know, today's the day. Today's the day I'm going to get killed on the highway. I bet none. I bet none. That was his words. I bet none. Well, I'll bet you none of you that think, well, there's no way I'm going to get this. None of you that think that, you know, probably you're running a tremendous risk. The other flip side of it is sure the news is going to report the first person that has any kind of side effect. It would be all over the news nonstop. It would be all over everything nonstop if people were really having adverse effects to these vaccines. It would be everywhere. You hear a little bit about it. It is not big noise because it is not significant. It is not significant from the standpoint of the benefits outweighing the bad. So with all that, I just say over and over, you got to get vaccinated, West Virginia. You're now at 63.5 or whatever percent of the 12 of the eligible from 12 and older. That's really good. Really, really good. From the standpoint of our 50 and older or 65 and older, we're knocking it out of the park. But absolutely, the more we get, the more we'll stop this terrible killer. Keep continuing to help me. Absolutely. Continue to help me for you to win prizes or whatever it may be. But help me. Help me get there. And again, Dr. Sherry Young, thanks for all you did, you know, and all you continue to do. Thank you a bunch. That's all I've got.